Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Becca Rose, who is the owner of Myofunctional Pathways based out of the Sheboygan area. Becca was a dental hygienist for over 20 years, and during her time in that career, she was introduced to a concept called myofunctional therapy. When her son was 3, she began to notice mouth breathing, a setback lower jaw position, and that he was sick a lot, which motivated her to learn more about how to help him and what myofunctional therapy really was. Through the learning process, she actually discovered that her own airway dysfunctions were the reason why at age 28, she had been diagnosed with sleep apnea and prescribed a CPAP machine. Becca became more and more passionate about this newly discovered missing link within her own family's health journey, so she decided to pursue sleep coaching, functional breathing, and myofunctional certifications, and to ultimately help others through this career. It's obvious that Becca practices what she preaches because as of 6 months ago, she no longer needed the CPAP machine she had been using for 14 years. Outside of work, Becca's hobbies include family activities with her husband and 7-year-old son, and expanding her podcast. And if you guys want to check it out, it's called Myo360, Holistic Solutions for Better Sleep and Better Breathing. If you've never heard of airway or oral dysfunction or myofunctional therapy, you're not alone, but I will tell you that these episodes could literally change your life. You'll hear us, Drea and I, talking about personal experiences within all 4 episodes as well, because our kids and my husband have benefited from myofunctional therapy in the past. And I can't forget to mention that Becca is offering a special discount for our listeners. You can receive $50 off your myofunctional evaluation by mentioning the Motherhood Alliance podcast. In our 4 episodes together, we cover a plethora of areas that myofunctional therapy can help, including mouth breathing, teeth grinding, poor sleep quality, sleep apnea, bedwetting, ear infections, crooked or crowded teeth, TMJ pain, and more. So turn up your volume and let's get started with today's conversation. Hey everyone, welcome back. We are excited to dive into talking about sleep and how we have so many sleep issues happening in society nowadays and how myofunctional therapy can actually help a lot of them. So let's just start out first with, Becca, what are some sleep issues that people are commonly experiencing, that you see your clients commonly experiencing?
Sleep apnea, snoring, teeth grinding, behavioral issues in children, bedwetting in children, concentration issues, and just feeling tired and run down all day long.
Yeah, I think, I feel like every adult everywhere is always like, oh, I'm so tired. Well, how are we actually sleeping? That's probably a good question to ask. So let's start with sleep apnea, because I think this has really become a big thing to talk about, and CPAPs and all this, and you have your own personal journey to talk through when it comes to sleep apnea. But can you just share for people who are listening that maybe have no idea, like what in general is happening with sleep apnea?
So when you have sleep apnea, essentially you stop breathing while you're sleeping. And in order to be diagnosed with sleep apnea, you have to have a sleep study, and there has to be so many events for so long each hour to get an actual diagnosis. But you stop breathing at night. And if you have a husband or wife or a bed partner, and they're going to know that you have this, like they're going to smack you. They're going to know that you're gasping for air. You as the person experiencing it are not going to know. You're going to feel exhausted, but you're not going to know that you're gasping and you're stopping breathing, but someone else will.
So in episode 1, we talked about how our facial structures have changed over time and how our our jaws tend to be a little bit more narrow, which then pushes up into the nasal cavity. And so we kind of talked about in episode 1. If you didn't listen to that, make sure you go back and that you do. But based off that conversation, what is the cause of them pausing their breathing in their sleep? Is that structure kind of the cause?
Part of it can be structure. If the airway in the jaw space is very narrow, there's not a place for the tongue to go. If the tongue can't fit into the space it has, then it's going to want to fall back into the throat. But part of it is, are the muscles in the throat and the soft palate and the tongue strong and toned and coordinated to begin with? Because if you think about muscles, right, if they don't have coordination and tone and strength, they're going to be floppy and weak. And it's the same thing with our airway muscles. So there's also a breathing component to that. How fast do you breathe? How much air do you breathe in? Because that's going to affect how the airway structures and the soft palate vibrate. And you can snore with your mouth open or your mouth closed. So there's a lot of different reasons. Weight can be a part of it, diet, medications. There's a lot of things.
What about like sleep positions too? Like my husband sometimes snores and I do smack him. But he only snores when he's on his back. So when he rolls over, it tends to be fine. So I don't know if that's part of it too, or if that's, I don't know.
Absolutely. Think about gravity.
Yeah,
if
makes
you're
sense.
on your back, your jaw falls down,
Yeah.
your tongue falls back into your throat, the muscles relax, you start breathing in more volume, things start vibrating more, you get more of that snoring, more of that obstruction, that sleep apnea type of event.
Is it normal to not breathe anyway? Like I know, like you said, in order to have a diagnosis for sleep apnea, that you need to have certain amount of episodes. It doesn't seem normal to stop breathing ever.
Right.
Yeah.
Yeah. And that's the issue with children. If a child goes to have a sleep study, because typically a child is not going to experience apneic events the same way an adult would. They classify that into a different umbrella of sleep disordered breathing, where it's not going to change the outcome unless there's something very severe. A child is typically not going to be put on a CPAP machine. So it's more like, all right, well, what do? We have the answer. We know whether they have it or not. But now what are they going to do with it? For the adult, they're going to do a CPAP machine. For the child, they'll say, oh, they'll outgrow it. They'll outgrow it.
I can't even fathom putting a CPAP machine on my kids. Are you kidding me?
Yeah.
Yeah. Well, so sleep apnea obviously is a problem. So when someone gets diagnosed with it, it's like you are stopping breathing. You're not getting enough oxygen. This is a problem. Is snoring in general a problem? Like how Drea just said, her husband, when he lays on his back, he might snore a little bit. Can you have a well-structured jaw and nasal cavity and have your facial muscles functioning well and still snore? Or is snoring typically indicative of a problem?
Snoring is the sound your body makes when it is struggling to breathe.
Okay.
I put that statement on my flyers that I hand parents.
Okay.
I'm going to say it
Straightforward.
again. Yeah. Snoring is the sound your body makes when it is struggling to breathe. To answer your question, though, if the skeletal structure is great, the jaw is nice and wide, the muscles say they've been through myofunctional therapy already, the muscles are toned, they're strong, they're coordinated, there's been a tongue tie, and they're still snoring, the next thing I would look more into is how are they breathing? Because how fast you breathe, the tidal volume of breathing too plays a huge role in snoring and turbulence and vibration of those muscles.
Is that something that you also assist with? Is
Absolutely.
Helping people with the way that they breathe? So tell us more about that.
So I'm also certified in the Buteyko breathing method, which is considered to be functional breathing. And the goal of it is to learn how to breathe differently all day long, which then equates into breathing correctly all night long. And it specifically works on slowing down your breathing so you take in less air. And you can do this anywhere you are. So it's not the same as yoga breathing or meditation breathing. It's meant to be habituated to do it all day long. And that helps. That could be 3 episodes all on its own, all the things that helps with. But I do a lot of that within my myofunctional therapy program as well.
I like how you're really focused on developing habits, because that's what it's all about. Breathing is something that people don't think about because it's something we do all the time, right? And so I know when I talk about this sort of stuff, because I kind of geek out on it too. But whenever I talk about this sort of stuff and I'm like, hey, it's about breathing, people are like, yeah, what so? And so it's when we talk about breathing and bringing it back into, like how we're supposed to be doing it right, people really kind of gloss over that. So I just love that you're bringing into habits and how we can establish habits over time, because then you don't have to think about it.
Right. And that's what happens with habits. You keep building on them. And we talked earlier about that neuromuscular connection where you literally make new muscle memory, new neuromuscular patterns, and that takes over and becomes your new normal. So when you learn that and it happens automatically, it's pretty life-changing because you can sleep better, you can breathe better, feel better. Blood pressure goes down, anxiety goes down, sleep just gets so much better. When you have a good night's sleep, you know it. And when you don't get good sleep and you did have good sleep, it's like, I want that again. It's so profound.
So you've had quite the sleep journey yourself, right? Can you share a little bit about how, because you were on a CPAP machine and when you were young, tell us a little bit about your journey.
So I was diagnosed with sleep apnea at age 28. I anticipate it was much younger than that, but I didn't have any studies done yet. My husband would tell me, hey, you sound like you're gasping. All the chronic or classic symptoms of sleep apnea. So hesitantly, I scheduled an appointment. And 14 years ago, there were no home sleep studies the way there are now. So I'd go to the hospital twice to do, the polysonogram, where they hook you up to a million wires. The first night, I didn't sleep well, and I had to go back and do it again. And so I had a problem falling asleep too. It wasn't just
you're in a hospital with all these wires. I'm sure you're going to sleep real well.
That's exactly what I was just thinking. How do you get any accuracy in that? Because people are so uncomfortable.
I know. Well, and they gave me a sleeping pill too, to help me sleep.
That doesn't seem accurate either.
And I still didn't sleep.
Let me drug you and wake you up. Okay, continue.
I know. It's going to affect everything. But anyway, so diagnosed with sleep apnea, wore a CPAP machine for the last 14 years until about 6 months ago. From doing myofunctional therapy, when I first learned this, I was doing it for myself, and I would do about 5 minutes of exercises twice a day.
When did you start doing myofunctional therapy for yourself then?
3.5 years ago.
Okay.
Yeah. I feel like I could have come off the machine long ago, but we just redid a sleep study to confirm it was safe for me to do that. So, but when I started Myo, I was doing exercises 5 minutes twice a day. And even after just a few weeks, my sleep got so much better. And that's pretty much what everyone says, I'm sleeping better. I'm dreaming more. I feel like I'm getting more rested because those muscles start to respond pretty quickly. But anyway, I had a new sleep study done. I had my own tongue tie release about 6 months ago. And then after that, I decided to retest. I did a home study that time and confirmed that I did not have any more apneic events that would classify me as being a sleep apnea patient. So I don't wear my machine anymore. Yeah.
So just to clarify, you used a CPAP from age 28 until just recently, but just in the last 3 to 3.5 years, that's when you started making changes that would allow this to happen for you. So are the myofunctional therapy exercises all that you had to do to change the function of your mouth to be able to get here?
Yes.
Wow.
Now a tongue tie release too.
Yes.
But not everyone decides to do that. And you can get off your CPAP machine in some cases. It's not guaranteed, but without having to do any procedures. You have to get those muscles strong. The way I describe this to people is, and we talked about the breathing is a big part of this. So if you're sleeping at night, and imagine you have a plastic water bottle. You suck all the water out, but then you keep sucking the air out and the bottle collapses on itself, so it squeezes in. That's essentially what's happening to your throat. So you have to keep those muscles strong so they don't collapse when you start breathing heavier and deeper at night. Strengthening those muscles is a game changer for sleep apnea.
So you're telling me too, is that getting sleep apnea diagnosed and having a CPAP isn't necessarily a lifelong commitment. Like you don't necessarily have to think that way. Because a lot of people will get a sleep apnea diagnosis and get on a CPAP and think that that's what they have to do the rrest of their life. But it doesn't have to be that way necessarily.
Yeah, it's not always a life sentence to the CPAP machine.
Yeah.
But you always want to make sure that if you get retested and make sure it's safe to come off your CPAP machine, which is what I did, even though I feel like I could have done that 3 years ago when I first started Myo. But I stayed safe and wore it until I knew it was safe not to. Yeah, there's no cure for sleep apnea. And there's lots of other things that can be done, like mouth guards, different types of mouth guards for sleep apnea. But the CPAP compliance is it's 50% or less, according to a lot of professional websites. So a lot of people don't wear it. And we can also help get them used to it by changing how they breathe, because the CPAP machine itself is a whole different thing. The way the air changes throughout the night, and that wakes people up. And then they're still having sleep apnea events with their CPAP machines on. So those machines now can track if you're still having events at night.
Wow.
And sometimes people come to see me and they're like, what's the point? Why am I wearing this thing if I'm still having 14 events an hour?
Well, yeah.
You know?
Right.
So if we work on the muscles, we support all the airway structure and then improve the breathing quality, that's going to improve how the machine works. And then that's going to help to reduce the episodes that you're having per night. I can think of a 65-year-old man off the top of my head that's what he came for. He was upset that he's wearing this machine and he was still having events at night. So we worked through that.
I think a lot of light bulbs are going off right now with people listening to this for sure.
I think another big one is teeth grinding. So how does that get impacted by these exercises as well?
When the tongue is able to support the whole skeletal structure, it doesn't fall back into the throat. When it doesn't fall back into the throat, the body can breathe better. The clenching and grinding and the TMJ issues that happen at night, that's the body's attempt to pull the jaw forward. Because especially if we sleep on our back and you look at someone with their mouth open when they're sleeping and their chin kind of almost falls into their neck, as they start to have obstruction to their airflow, the jaw pulls forward. So it starts to grind in this forward position and opens up the airway so you can breathe. Now, the tricky part with that, whether you're a child or you're an adult, every time that happens, you go into some kind of sleep breathing disordered pattern, whether it's as simple as your mouth just falling open or you're going into a full apneic event. Every time that happens, you get kicked out of your deep sleep cycles and you start over again at stage 1. So that's where a lot of this like fatigue in children and adults and maybe behavioral issues and lack of concentration, because you're never getting to those full sleep cycles. You keep starting over. And people know how they sleep nowadays. They wear watches, they wear rings, Fitbits, whatever it is to track their sleep. And now that's not laboratory accuracy, but it at least gives you a guideline to measure against so you can see how you're doing on average.
Well, then you think about how much that's connected with the rest of the body. If you're not sleeping well, that can lead to like heart and kidney and metabolic health complications. Like it's so important to be getting good sleep. So I love your story, and I love that you have found your passion and your career from your own experience. It's unfortunate that you and your son both had some health challenges when it came to having to rehab those. But your story speaks volumes to giving hope to people that a lot of their challenges can be solved through myofunctional therapy. So I feel like that's amazing. One more thing I did want to ask about, though, is that you brought up TMJ and like facial muscle pain. And I think a lot of people in today's stressful world, we find ourselves even clenching during the day or just holding a lot of stress in our jaws during the day. So what are your recommendations or tips on helping people to kind of break that habit within the daytime?
Within the daytime, you have to consciously think about keeping your teeth separated at rest. So when I say at rest, I mean you're not talking, you're not chewing, you're not eating. So if your mouth is at rest, your tongue should be up on the roof of the mouth, the teeth should be separated just a couple millimeters, and the lips are closed. As the tongue supports the structure, your jaw pulls forward a little bit into more of a neutral position, and you're more likely to start noticing if you're clenching your teeth. I used to clench my teeth all day long. Like all day long until I purposely, before I knew any of this, I would stick my tongue between my teeth. My mouth is closed, so you'd never know that I was doing that. But I put my tongue purposefully in between my teeth so that if I started clenching at the time at my job,
you'd know it.
I would feel that feedback on my tongue. And now I'm like, what was I thinking? And I used to tell my dental hygiene patients that, like, oh, you're clenching. Oh, but if I knew then what I knew now.
Yeah.
Right. So it's all about just creating that stability for your structure. And then you don't have muscles that are overcompensating and doing harder or doing more work than they're supposed to. and that takes the tension off the jaw and reduces facial pain.
Wow, that really makes
a
sense.
lot of sense.
Yeah.
Yeah.
And like Drea said before, where's your tongue right now?
Yeah, where's your jaw right now? What are you doing?
We're going to be thinking that through all these episodes.
How's your body? Is it tense? Relax.
Yeah. Yeah. No, this was super helpful. And I feel like it's going to give a lot of hope to people. So how can people reach out to you if they're hearing things in here where they're like, oh my goodness, I'm on a CPAP machine. I would love to just learn more about if it's an option for me to get off of it someday, or what would that actually look like? How should they reach out to you and contact you?
I'd love to have a conversation with someone in this position because, again, I can personally relate. So find my website, myofunctionalpathways.com. You can schedule a free discovery call. We can hop on a Zoom and talk through your symptoms and answer your questions. Also, Myofunctional Pathways on Facebook and Instagram.
And you are based out of Sheboygan area. So if somebody is listening to this and they don't live as close to Sheboygan, what would that look like to be working with you? Do you do virtual visits? Do they come and see you? How does that work?
I offer both options. So if someone's within a 2-hour drive, they'll usually come see me for the very first appointment where we do the assessment. And then from there, everything can be done virtually. We can do the evaluation virtually as well, but it's nice
much
to come
better
in person.
to be in person. And how long is the evaluation usually?
Anywhere from an hour and a half to 2 hours.
Okay.
Sure. But to make it a one-time drive to do that, to be able to then also be able to do virtual ongoing, that seems worth it.
Better than a 15-minute doctor appointment. Let's just say that.
Yeah. Yeah. So I work with people all over the country virtually.
Awesome. Well, thank you so much, Becca. This was a super enlightening conversation. And for our listeners, stay tuned. We're going to be jumping into talking about bedwetting, ear infections, and crooked teeth in kids in the next episode. And then in episode 4 with Becca, we're going to actually talk about the details of like what to expect when you're starting myofunctional therapy and what that journey actually looks like. So stay tuned for more. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.